Let's be honest for a moment. What scares men more than losing their job, their hair, or even their memory is losing this, their ability to get hard and stay hard. We don't talk about it at the bar. We don't bring it up at dinner. And most men won't even admit it to their doctor. But inside, it haunts us. Because when your body doesn't respond the way it used to, when sex feels like a source of pressure instead of pleasure, you start to wonder, what's happening to me? And that's exactly why you clicked this video. It's called 5 Exercises That Will Boost Your Erection and Sexual Function. Not just help or support, but actually boost it naturally, permanently, and backed by real science. Because the truth is, most men have been lied to. We've been told that if something's wrong down there, it's all in your head, or worse, it's just normal aging. We've been trained to think the only solution is a little blue pill, a late-night ad, or a bottle of overpriced supplements with words we can't pronounce. But what if the real problem isn't psychological or pharmaceutical? What if your penis is simply trying to send a message, a biological red flag that the rest of your body is falling out of sync? See, when you can't get or maintain an erection, it's rarely just a penis problem. It's often a full-body warning sign, like a check engine light flashing before a breakdown. And here's the kicker. In most cases, this isn't permanent. It isn't untreatable. And it definitely isn't your fault. In fact, most erectile dysfunction in men over 35 stems from 3 silent, fixable issues: poor blood flow, weak pelvic muscles, low cardiovascular and metabolic health. And guess what all 3 of those respond to? Not pills, not surgeries, not shame. Exercise. That's right. Targeted, consistent movement, done the right way, can repair the same systems that fuel sexual function in the first place. Multiple clinical studies have shown it, but almost no one is talking about it. Because here's the controversial part. Most guys who think they have erectile dysfunction don't have a disease. They have disuse. Like any other system in your body, if you don't stimulate, train, and support it, it atrophies. Your muscles weaken, your blood vessels harden, your testosterone dips, and your erections suffer. But there's good news. You don't need a gym membership. You don't need to be a yoga master. And you definitely don't need to be in your 20s. These 5 exercises can be done at home in under 30 minutes a day and have been shown to improve erectile function, stamina, and even sensitivity without any medication. And no, this isn't about doing more cardio or trying Kegels once and forgetting about them. This is a system based on decades of data, designed to restore function by targeting the root cause, the biological systems that make arousal possible in the first place. So, what does the science actually say? And which 5 exercises can not only improve your erections, but potentially save your life? Let's start with a myth that's quietly wrecking men's health: that erectile dysfunction is all about testosterone. It's not. Sure, testosterone matters. But what the science now shows, across dozens of peer-reviewed studies, is that the most powerful predictor of strong, lasting erections is circulation. That's right. Erections are a vascular event. They're about blood. And if your arteries aren't healthy, neither is your erection. In 2016, researchers from Harvard and the University of Florence found that men with erectile dysfunction were significantly more likely to have underlying cardiovascular disease, even when they showed no other symptoms. In other words, your penis could be the first warning sign your heart is in trouble. Think of your vascular system like a network of garden hoses. When everything's working, blood flows freely, pressure builds, and you get a firm, sustained erection. But when the hoses get kinked or clogged with plaque, nothing works right. Blood can't get where it needs to go. And arousal, no matter how intense, fizzles out. So what opens those blood vessels back up? Aerobic exercise. In a 2021 meta-analysis published in PubMed, researchers reviewed over 20 randomized controlled trials and found that men who performed moderate to vigorous cardio 4 times per week experienced a measurable increase, about 3.8 points on the IIS scale, which is the gold standard for tracking erectile function. This isn't minor. That kind of improvement can shift a man from clinical ED back into the normal range. What kinds of cardio help? Simple stuff. Brisk walking, cycling, swimming, even mowing the lawn if it gets your heart rate up, counts. The goal? 30 to 40 minutes, at least 4 days a week. But cardio alone isn't enough, because the second system involved in arousal, the pelvic floor, is like a hidden foundation. It sits deep beneath your core, stabilizing the muscles that control not just erections, but ejaculation and bladder control too. A landmark study in the journal Therapeutic Advances in Urology showed that 40% of men with erectile dysfunction regained full function after just 6 months of structured pelvic floor training without medication. This is the science behind Kegel exercises for men. Yes, Kegels aren't just for women, but most men do them wrong. They squeeze their abs or their glutes, missing the real target, the puboxygeus muscle or PC muscle, which wraps around the base of your penis like a sling. To find it, try stopping the flow of urine midstream. That subtle internal contraction, that's your pelvic floor. Now, imagine combining that internal squeeze with movements that activate your glutes, hips, and core. That's what the bridge with pelvic engagement does. You lie on your back, bend your knees, press your feet into the floor, and as you lift your hips, squeeze the pelvic floor like you're holding back gas or urine. Hold for a few seconds, lower, and repeat. According to Genesis Lifestyle Medicine and multiple urologists, this fusion movement not only strengthens the key muscles involved in sexual performance, but also improves circulation to the pelvic region, which supports nitric oxide release. Why does that matter? Because nitric oxide is what allows your blood vessels to expand in the first place. Without it, erections become weak, delayed, or impossible to maintain. And you don't get nitric oxide from pills. You get it from movement, from oxygen, from circulation, from stress reduction. Which brings us to something unexpected. Yoga. Yep, science-backed yoga. A small clinical trial published in the Journal of Sexual Medicine found that men who practiced daily yoga, including deep breathing and mindfulness meditation, saw statistically significant improvements in arousal, orgasm, and satisfaction. So now we've busted 3 myths. ED isn't just about testosterone. It's not always psychological, and it's definitely not untreatable. It's biological, it's circulatory, and it's trainable. Next, we'll look deeper into why these systems fall apart, and what that tells us about aging, hormones, and the hidden lifestyle traps making millions of men go soft way too soon. So now you know, blood flow, pelvic strength, nitric oxide. The biological mechanics are clear, but let's dig deeper. Because if this is just about blood and muscles, why are so many men struggling today at younger and younger ages? The answer isn't just in your body, it's in your lifestyle. Let's start with the quiet saboteur, chronic stress. In today's world, we live in a constant state of low-grade fight or flight. Deadlines, phone pings, blue light, financial pressure. The body doesn't know the difference between an angry email and a lion in the wild. And when you're stressed, your body pumps out cortisol, a hormone that, in high doses, kills libido, restricts blood flow, and interferes with testosterone production. One study out of the University of Texas showed that men with high cortisol levels had significantly lower sexual desire and performance, even when testosterone was normal. Now pair that with sitting. Yes, just sitting. 8 hours a day, 5 days a week. That's not just a productivity killer. It's a pelvic disaster. When you sit too long, your pelvic floor muscles weaken. Blood flow to the groin slows, and your glutes, key stabilizers for pelvic circulation, become inactive. This creates something called pelvic floor dysfunction, a condition often misdiagnosed or ignored. It's why more urologists are now referring patients to pelvic physiotherapists, people who retrain the muscles we've forgotten how to use. Still think ED is just in your head? Let's add another villain, metabolic syndrome. This is the toxic trifecta of abdominal fat, insulin resistance, and high blood pressure. And it's exploding in men over 40. According to the Cleveland Clinic, over 60% of men with ED also have early-stage metabolic syndrome, even if they haven't been diagnosed. And this condition doesn't just affect energy or waist size. It damages endothelial function, the lining of blood vessels, making it harder for blood to flow where you need it most. So here's the truth most men never hear. Your penis is a barometer for your overall health. If your morning erections have faded, if arousal feels weaker, if you've lost confidence in your own body, it's not just aging, it's a system breakdown. But here's the flip side. Because the erectile system is so sensitive to health inputs, it's also one of the first things to improve when you change course. In fact, researchers from the Mayo Clinic found that combining aerobic exercise, resistance training, and pelvic floor activation could reverse early-stage ED in over half of patients, without medication. They also found that when combined with mindfulness-based stress reduction, those improvements happen faster, often within just a few months. So, where do you begin? What can you actually do today to take control of your sexual function without relying on prescriptions, gimmicks, or guesswork? Here's the playbook. 5 proven exercises, backed by real science. Simple, repeatable, powerful. 1. Kegel exercises, your hidden power switch. These aren't just for women or seniors. Kegels target the puboxygeus muscle, a sling-like muscle at the base of your pelvis. It controls blood flow, ejaculation, and erection rigidity. A 2005 clinical study published in BJU International found that 40% of men with ED regained full function after consistent pelvic floor training, no drugs involved. Here's how to start. Identify the right muscle by trying to stop your urine midstream. Contract that muscle, not your abs, not your glutes. Hold for 3 to 5 seconds. Release. Do 10 to 15 reps. Add quick flicks, rapid 1-second contractions. 10 per session. Perform 3 sets per day, morning, afternoon, night. Once you're comfortable, graduate to standing and movement-based versions, adding complexity and strength. 2. The bridge. Activate your glutes plus pelvis together. Think of this as Kegels with bonus horsepower. Here's the protocol. Lie on your back, knees bent, feet flat. Engage your pelvic floor as you lift your hips off the floor. Squeeze at the top, glutes and pelvic floor firing together for 3 to 5 seconds. Lower slowly. Repeat for 10 to 15 reps. Do 2 to 3 sets. This exercise not only builds strength, it increases blood flow to the entire pelvic bowl. 3. Aerobic conditioning, fuel for the engine. This is your circulation booster, your nitric oxide amplifier. Aerobic exercise enhances endothelial function, the thing responsible for opening up blood vessels. Here's your target: 30 to 40 minutes of moderate to vigorous cardio, 4 days a week. Think brisk walking, cycling, swimming, or jogging. Consistency matters more than intensity. According to a 2018 meta-analysis in Sexual Medicine Reviews, men who maintained this routine saw significant improvement in erectile function within 12 weeks, especially when paired with resistance training. 4. Strength training, the hormonal reset. Lifting weights isn't just about aesthetics. It's a testosterone prescription written by evolution. Focus on compound movements like deadlifts, lunges, pull-ups, rows. Aim for 2 to 3 full body sessions per week, 3 to 4 sets per movement. Why it works? These lifts hit large muscle groups, stimulate growth hormone, and improve insulin sensitivity, all tied directly to bedroom performance. 5. Yoga and mindfulness, the mental edge. It's not just about flexibility. Yoga improves pelvic circulation, reduces tension, and enhances mind-body awareness. When you pair this with breath work and mindfulness, you lower cortisol and improve your body's ability to stay in parasympathetic, rest and repair mode, critical for arousal. Here's a simple plan: 15 to 20 minutes of yoga 3 times each week, hatha or vinyasa styles. Focus on hip openers like pigeon pose, bridge, and reclined butterfly. End each session with 5 minutes of deep breathing. Inhale 4 seconds, exhale 6. One small clinical trial found that daily mindfulness alone improved erectile function and reduced anxiety in men with performance issues. No exercise required. Let's bring it all together. This isn't a one-trick cure. It's a toolbox. Kegels for control, bridges for structure, cardio for flow, lifting for hormones, yoga for calm. Stack these, and you're not just treating ED. You're rebuilding the system that supports masculinity from the inside out. And don't skip the final piece. Get your labs checked. Ask your doctor for total and free testosterone, PSA, prostate-specific antigen, lipid panel, HbA1c, blood sugar, CRP, inflammation marker. Why? Because information is power, and sexual health is often the first place your body whispers that something's wrong. If you ignore it, it shouts later. But if you listen, you don't just fix the problem. You become stronger, clearer, and more connected to your body than ever before. Now tell us in the comments, what's one exercise from this video you're going to start tonight? And what other men's health topics do you want to see us tackle next? Your voice matters, and your health, it starts now.